Hi, Mike Gibson here, and I'm joined by my good friend and colleague, Kohli, here for Snackable Health. Welcome, Pyle.
Hi, Mike. Nice to see you.
A lot going on today in COVID. I've been watching every day what's going on in the wastewater. You know me, and it just keeps rising. It's higher than it's ever been during the pandemic. But Pyle, what's interesting is that the rate of hospitalization, while it's timed with the wastewater rise, the number of hospitalizations aren't going up as much as they did in other waves. And that's consistent with what we're seeing in South Africa with Omicron. The number of ICU admissions is about a quarter of what it was for Delta. So do you think we're rounding the corner in terms of severity here with Omicron?
Mike, what I hope and what we sometimes see with viruses is as they evolve, they lose their punch. In order to be more transmissible or contagious, it is adaptive for them to keep their host alive. So I'm really hoping that science has led us to perhaps a milder version. I also think some of what we're seeing, especially in Massachusetts with hospitalizations not being as severe, is a result of immunity. It's because the vaccination rates are high. South Africa, of course, not quite as high, 30 to 40% vaccinated. So I do hope that this ends up being a milder variant for sure. We're ready for that.
The other hypothesis is that, well, it looks milder, but that may be because people had previous infection with Delta. And a lot of the times you're seeing breakthrough infection with Omicron, and maybe it's their natural immunity.
That's exactly right. And in fact, we have data that tells us that the rate of reinfection with Omicron is substantially higher than what we saw with Delta. So I don't want people that have had COVID before to really feel complacent around this new variant. We are also seeing that Omicron infection can occur even after 2 doses of a messenger RNA vaccine. New data from the UK this morning tells us that that third dose, the booster dose, really does help augment the number of antibodies. And hopefully that translates into a clinical protection from infection as well. But the message here, Mike, is clear. Keep your guard up until we know more.
Thanks, Pyle, and thanks for joining us here from Snackable Health.